is a doctor. And for the coming midterm festival, he thinks it's a good time for family reunion. And he thinks the best social medicine to improve the relationship of family is open our mind, open our hearts. Tonight, he's going to present his first project in the basic manual. Project number 1, the icebreaker. The objectives are speak before an audience, use existing speaking skills, introduce self to fellow club members. The evaluator for this project is Wilson Tam from MBA Alumni Club. And the title of the speech is Open Mind, Open Heart. Please join me to welcome Dr. Cheung.
Hello, my name is KF. Good evening, fellow Toastmasters and guests. Actually, I was wondering what I should speak about today, and then my mentor, Hilton, he suggested that I should talk about why and how I became a doctor. So, many years ago, my father told me that he asked his doctor about the life and prospects of a doctor, and the answer was that being a doctor can't make too much money. And then he said that at least it's a good prospect and relatively stable life. And there was a comment given to me by my father to my sister, and then I just followed the steps to become a doctor. I thought that at least I know what would be wrong. This time I told me if I feel uncomfortable, so that I can treat myself, then my life will be healthy. Only in the last few years did I realize that medical education doesn't teach doctors the most important cause of disease, which is about what's going on inside human mind. And what's going on in our mind is already proven to be able to produce a lot of stress hormones, which can result in a life filled with disease and diseases. Physical disease, mental illness, unhealthy decision making, bad habits, and social disease. Social disease meaning relationship problems with family or at work. Medical education actually closed doctors' minds into learning only body disease material skills, which is for external control of the body through drugs or surgery. It doesn't teach doctors emotional health mind skills, which empower the patient to control his own body, at least partially. So, poor communication skills actually prevents open heart. It also leads to premature judgment, which prevents open mind, resulting in a vicious circle. So I'm joining this club to improve my knowledge on this aspect. Next question, how I became a doctor? The answer is quite simple. I just go through medical school. But I think this is a too simple, sometimes naive answer. I think the real meaning behind the question is how I go through those hurdles in medical school. Also, the answer is also very simple. Once I found my target, I just focus on what I want without spending time on what I do not want. This is the law of attraction, which says that you tend to attract to your life whatever dominates your mind, whether positive or negative. Likewise, people want to protect their health and they look for disease. And they look for disease and the stress hormones goes up, they really get more disease. I'm now learning the skills to open my mind and my patient's mind to change our instinctive negative defensive attitude to a positive learning attitude so that we can appreciate the importance of how disease directly causes diseases and how at ease leads to health. Overprotecting our old beliefs about material therapy will trigger our negative thinking against mind-body therapy. I'm also learning my skills, communicating skills to open my heart and my patient's heart. Firstly, freedom of speech, expression of our feelings is important to avoid pent-up emotions. Secondly, open our heart to receive positive emotion, which can enrich our life and improve our health. So, I means you. We means well. Opening our minds and heart can lead to a successful week. Actually, I found out from medical history that the current biomedical system, which is used to train doctors, is already 200 years old. The theory separates body and mind and create a barrier in between, so that if you see doctors, they won't get into health, only flow disease maximum. So the system trains doctors. Doctors train patients into looking for disease, whereas health is in the other direction. So if you look for disease, you activate your stress system and actually cause more disease. However, this mechanism is relatively systematically neglected by the medical field. And actually, an article in the British Medical Journal in May this year says, it got a title, How to Stop Medicine from Harming Healthy People. That's the actual title. And I found a new interest and meaning in life to improve my skill to promote the newer biopsychosocial model of disease, which is not new, it's actually suggested by psychiatrists in 1977. So that patients going to doctor's office are no longer kept on the road of disease, and then the doctor guide the person to complication and death. Nowadays, doctors respect patients' preference. If you want to avoid subconsciously asking for unnecessary harm for the medical system, or you want to use less drugs or surgery to treat a disease, then I suggest you to read my website. Body Medicine, College Today.
Thank you, Kian. Now it's 1 minute of silence. In this period,